Welcome, folks. You are at a training from the Seattle-King County Coalition on Homelessness. We have Northwest Justice Project here today to talk about long-term care services and rights and for folks that are experiencing homelessness. So we have Meredith Grigg and Ashley Greenberg, both attorneys with Northwest Justice Project, and they will be introducing themselves here in a moment as after I intro us and hand us off. But my name is Jody. I use she, her pronouns. I'm a manager here at the coalition. I want to have Tim officially introduce himself on the recording, if you wouldn't mind, Tim.
Sure thing. My name is Tim. I use he, him pronouns, and I am the member, member services coordinator. My title just changed. Great to be here with you all.
Member extraordinaire is what we might just like internally call you, right?
That'll work, yeah.
Thank you. For those of you that may be a little less familiar with the coalition or newer to what we offer, we are a small nonprofit. We largely really work in the arena of policy and advocacy and really at the very hyper-local level. So Seattle, King County, doing a ton of advocacy and work around better policies, systems, good investments in budgets around housing, homelessness, anti-poverty measures. We are usually heavily engaged at the state level, and so very much involved in tracking things that are happening at the state legislature right now. Every month, we hold a monthly general membership meeting. This is open to the public, and this is really an opportunity, again, to make connections with your fellow colleagues in this work. We usually try to offer, some level of skill, resource, some nugget of information that's going to make your job hopefully easier, help you find resources and access things for the clients and the folks that you work with a little bit better. And then we also do a ton of trainings. And so one of the big things that we've done for a long time is public benefits. And so we have a whole series called Public Benefits Are Key. Today's training is an installment in that series of benefits trainings. We started this year off with kind of some very specialized training topics. So we started with Social Security, SSI, SSDI. We went to the Working Families Tax Credit. Today, we've got Northwest Justice Project here to talk about long-term care and homelessness. And then in April, and we will drop links to all of this, we're going to start back up with ABD and HEN, so age, blind, disabled, and housing and essential needs. We'll offer TANF and Work First, and then Medicare, Medicaid, and then we'll have a couple others later this week. So we're just, we're really leaning into some of the core programs and benefits that people likely are eligible for, that they're entitled to, and how to make sure that you and your colleagues know how to access that for folks and make that process simple, because these are not easy systems for folks. We have a training and professional development page, which we will also drop into the link for folks. And that's where you can access previous trainings on our blog. You can register for upcoming trainings. Tim and I are really super available, so we'll make sure you have our emails and you can be reaching out to us for any kind of needs that you have. It is recorded, for better or for worse today for me with my vacation brain, but this is being recorded. We will have a nice blog put up with any resources that Meredith and Ashley can share with us along with the recording, so you can share that out with your colleagues. Once that's available, anybody that is registered for this meeting will get a follow-up training email that just says, hey, here's the blog, and then you can share that out widely. If you don't want to be included in the recording, you just have to stay on mute. We're very good about tracking the chat, and we will make sure to get that question into the recording and the answer into the recording, even if we maybe respond directly in the chat, but we'll try to capture that into the recording for everybody. If you're feeling comfortable and want to share your face, we love seeing faces, but we also know that that's not always available to folks. Tim, anything you would add that I've missed in our usual intro for folks?
I feel like that covers it. I've included the links to future public benefits or key trainings in the chat. There's also that professional development and training page where people can see a roster of what we'll have in the future. If anybody hasn't signed up for emails to get our general emails, that can be a great way to get in touch with everything that we're doing, from kind of state level policy advocacy to some of those more, like Jody was saying, hyper local actions and resource sharing. I am going to drop that opt-in link in the chat right now. And if anybody has any questions about, perfect, if anybody has any questions about these trainings or other aspects of the coalition, please email us at jody@homelessinfo.org and or tim@homelessinfo.org.
Thank you, Tim. Well, on that note, I am really excited to hand the floor over to Meredith Grigg and Ashley Greenberg. They are both attorneys at the Northwest Justice Project, and they have an amazing amount of really fascinating and important information to share with you all about long-term care rights, particularly how this intersects with people experiencing homelessness, and sort of what you should be aware of as you're working with folks. So Meredith and Ashley, thanks so much for being here. I will hand the floor to you.
Awesome. Thank you so much, Jody. And I'm actually realizing on this beautifully sunny day, I moved offices a few months ago, and I think that this is the first time that I have given a training on a sunny day in my new office. And so I apologize in advance for the weird shadows or any movement that I do around to avoid that glorious sun that we are all seeing. Meredith and I are just super, super delighted to be here with you all. I'll also say, if folks want to, if folks want to drop questions in the chat, Meredith and I will do our best to address them as they go. But also, Jody and Tim, if you could kind of monitor some of the questions that are coming through, because we're leaving ample time at the end as well for questions. And so then you can just let us know if there's anything that we've missed or anything like that. And so if everyone could stay muted during the presentation, drop some questions in the chat if you want to kind of like look at everything. Folks can unmute if they want, raise their hands, whatever, and we'll kind of go from there. So the topic for today's training in this public benefits series is long-term care and long-term care discharges, otherwise known as long-term care residents left in the hospital or on the streets. I'm Ashley Greenberg, and my co-presenter today is Meredith Grigg, who has a lovely sun halo around her head when you see it. Next slide, please, Meredith. Meredith and I are both attorneys at Northwest Justice Project, which is Washington State's largest provider of civil legal aid, meaning non-criminal legal assistance for low and moderate income people. NJP has 17 offices throughout the state with hundreds of attorneys working in those offices. Next slide, please.
Hold on just a second. Sorry, Ashley.
No worries.
We also have hundreds of paralegals, not hundreds, but paralegals and staff. We've got lots of great resources and folks working with us.
Absolutely.
Okay. I'll get better at the slides too.
So here are examples of some of the types of issues that NJP works on: family law, public benefits and protection of income, money, debt, and collections issues, education rights, including special education, discrimination, and school discipline, particularly involving students of color with disabilities. We also work on housing stability, on reasonable accommodations, foreclosure prevention, eviction defense to preserve housing stability and prevent housing loss. We also work on access to medical care and benefits. This means advocating with Medicaid and Medicaid managed care organizations, We also do a fair amount of work on behalf of people who are either clients of the Developmental Disabilities Administration, DDA, who are trying to become DDA clients. And we also do a significant amount of work on Medicaid long-term care, which is the topic of today's presentation, as we'll discuss. As you can see there, NJP also does employment work. There on the right-hand side of the screen, you see that NJP also has a number of specialized units and projects serving specific populations of clients. So veterans, farm workers, Native Americans, victims of crime, TB survivors and seniors, and patients at Western State. Next slide, please. Meredith and I actually both work in specialized projects at Northwest Justice Project. And so I'll describe my project first, or the project that I work at, and then Meredith will describe hers. So I work in a unit called the Washington Medical Legal Partnership, or MLP. This is a partnership between Northwest Justice Project, Seattle Children's Hospital, and Harborview Medical Center. MLP is actually a model of partnering between legal aid or legal services and medical providers, where the two come together to work on better health for patients. We're one of about 300 or 400 MLPs throughout the country, and each one looks a little bit different with partners and things like that. There's actually a national center on medical legal partnership. You're welcome to Google it and look it up if you want more information about the model. But ours specifically here out of Northwest Justice Project's King County office is this partnership between NJP, Seattle Children's, and Harborview. So the purpose of MLP is better health through legal advocacy. So we specifically focus on situations where there's a barrier, a legal barrier to good health, or where someone's disability or medical condition is deeply tied to their legal issue. So some examples of this are where someone needs a reasonable accommodation to safely remain in their home. Like maybe they're discharging from the hospital in a wheelchair and need their landlord to move them to an accessible unit, or they need a reasonable accommodation to break their lease without penalties so that they can move to an accessible unit. That would be one example. Another example is where Medicaid is not covering a service or medical equipment that a patient needs to be healthy, or where a student is frequently being suspended from school, but the root cause is that some behaviors that are directly related to their disabilities are causing the behavior in school that's leading to the suspension. So all of those are examples where really it's the health and the medical issues are tied up with these legal issues, and everything together is serving that barrier to good health. So we get involved and help to address those. And so these are some examples of what we call on our team health harming legal needs. In terms of today's topic of long-term care discharges, at Harborview and our work there, we see instances where long-term care facilities, and Meredith is going to explain exactly what those are in just a minute. And once she kind of gets into that, all of you, I think, will say, oh yeah, I actually know, and I see a lot of that. When long-term care facilities dump residents they do not want any longer in the Harborview emergency room, like maybe they have the ambulance come and pick them up, and or they refuse to let residents come home from the hospital when they're medically ready to discharge. And so that's really the topic of today's conversation, is talking about situations where those sorts of facilities then are illegally discharging residents and not letting them stay in the facility or come home to the facility after a hospitalization. A final note is that at our Seattle MLP team, we have 5 attorneys, 2 amazing legal assistants, and also 2 managing attorneys who supervise a number of different teams, including the MLP and then Meredith's team too. So Meredith, I'll let you explain a little bit more about your work now and the work that you kind of do around long-term care discharges and all of that.
Great. Thank you, Ashley. And shout out to Anna, who's in the audience and is one of our amazing MLP legal assistants. I'm Meredith. I'm like Ashley said, I'm an attorney with the Northwest Justice Project in the Seattle office, and I do work under a different project. It's I'm a team of one actually, but we at Northwest Justice Project have a contract with Aging and Disability Services that serves King County, and our contract is to serve King County seniors. So anyone over 60 will qualify based on depending on their problem. And I'm doing all sorts of things, but mostly focused on public benefits for seniors. And you'll see how it becomes sort of important in the work that we do, Ashley and I, and how we approach these problems, because with regard to issues of discharge from a long-term care facility, Ashley's dealing with clients who are in the hospital. So it will change the way that she approaches these cases to how I approach the cases, because most of my clients are still living in the facility. They haven't been taken to the hospital, and they're facing discharge within the facility. So let's start in on when we say long-term care facility, what do we mean? There are several kinds in Washington state. Nursing homes are the ones you typically think of, but we have a lot of different community options as well. And actually Washington is sort of at the forefront of providing more community services than a lot of other states. And it is this push towards making sure folks who can live safely in the community have different options, and not everyone needs to be in a nursing home. And the hope is, again, to integrate folks into the community so isolation isn't a problem. We have nursing homes. We also have assisted living facilities. We have enhanced services facilities, which is one you might not have heard of before. The idea, again, is to sort of create this like the longevity of services. So the idea is right now you may need assisted living, just a little bit of help, but you might have a diagnosis of dementia, for instance, that will mean you'll need more care as time goes on. And so instead of having then to move to a different facility for memory care, you could get all of that within the one facility, because moving can be pretty traumatic for folks. We'll talk about that a little bit. But so now we have enhanced services facility. Adult family homes are more, again, this idea of integrating folks into the communities. You might have an adult family home down the street from you. You may not know it. A lot of times they're, these folks who have homes who've converted some part of their home into an adult family home. And then they care for people. I had a client recently in Kent. And so the upstairs was the family home, the provider, his family was there, and then they had converted the downstairs into different rooms for residents living in the adult family home. There was a nice community area for the residents, really nice actually. And then, all the things that they need, ramps and grab bars and all the things. So it has less of a feeling of living in sort of a larger community and more the feeling of living in a home with roommates. So the cost is pretty intense. If you haven't had to think about the cost of long-term care facilities, and a lot of clients say this, it's a little shocking. There's a lot of sticker shock when folks move into one of these facilities and think about how they're going to pay for it. So just I looked at the averages for Washington state. Nursing homes can run up to around $10,000 a month. Assisted living facilities, enhanced, veterans homes, adult family homes, these community options tend to be a little less because they require less care, but still pretty expensive. So when we think about, how do you pay for these services, I don't have, you know, my income wouldn't support living in a nursing home. So what are the options for paying? And we talk about Medicaid because Medicaid is actually the largest payer of long-term care services in our country. You know, again, most people don't have the wealth to afford that monthly cost of care. So generally what happens is they'll pay, and then I should mention too, there is long-term care insurance, but it's a relatively new system, not well regulated at all. There are a lot of fixes. So when people think, oh, but can't you just get long-term care insurance? You know, it's not always a great option. There are sometimes caveats to coverage, there are wait periods. Again, it's not super well regulated. So that's why Medicaid tends to jump in and the state shares the cost of care with the resident. So generally the way we see this working is if somebody does have money they've saved through their life, they have some amount of retirement, they have to use that money to private pay for their cost of care. So a lot of times we'll see somebody with, let's say they have $100,000 in savings, and then they have their Social Security income, but you know, it's not $10,000 a month for a nursing home care. So they'll pay with their income, they'll supplement with their savings, and of course their savings will work its way down until it'll come to a point where they don't have the additional savings to help with the cost of care. So then they have to apply for Medicaid. The reason they're spending that savings down is because Medicaid has a resource limit of $2,000. So, you know, again, folks have this money in savings, they're using it month to month to pay for their care until they've worked it down to $2,000. And, you know, right before that, we'll apply for Medicaid. And then the state will start paying the additional amount that's owed to the facility. I'm trying to think of what else I need. Anything else I'm missing about the Medicaid process, Ashley? Oh, you're muted, sorry.
One would think like you're cyanide. So can you talk a little bit about the difference between just general Medicaid coverage and then long-term care Medicaid, and then also functional eligibility in addition to income eligibility, and a little bit then what do we, when someone is on long-term care Medicaid and they're kind of functionally and income eligible, what does that kind of generally mean about their needs? And kind of, because I think for both of us, we really see it tied into all the folks who are here today at today's training and things like that, and like the folks that they're working with.
Right. Yeah. No, so yeah, when we talk about Medicaid, you know, a lot of people think about Apple Health and Medicaid to cover the cost of medical care like a regular insurance provider. When you need long-term care, it's a different kind of Medicaid, and you have to apply for Medicaid for long-term care, and kind of different programs. I don't want to get too into the weeds, but different programs if you're going to a nursing home versus the community options, but it looks fairly similar in terms of the application process. And the case manager assigned to your case will do a review. And as Ashley said, there's the functional review and there's we'll call it just the financial review. So they'll first look at your finances to make sure that you're eligible for Medicaid financially. As I mentioned, that resource limit is the one that folks are really paying attention to. Usually the income is not an issue for folks. I've listed the income amount. So generally speaking, most people are income eligible for Medicaid for long-term care. It's the resources that usually catch people up. And when I say resources, there are certain kinds of resources that are exempt. So house is exempt. If you do own a home, they certainly don't want to take your home from you. And then a car is exempt. There's some certain other kinds of resources that are exempt, but certainly cash or anything that's considered liquid that you could use to pay for your cost of care instead of the state paying for it. So the DSHS will do that first, that initial determination about your finances. Once that's complete, and of course these are sometimes overlapping, but I think the idea is they do the financial, that's the easy part. And then they'll look to see what your medical needs are, whether you're medically needy or medically eligible for Medicaid. And typically the answer is yes, and then it's a question of what kind of care you need. So they'll do a whole assessment. You may have worked with folks who were getting some sort of long-term care, whether in their home or in one of these facilities. They'll do a whole assessment about what this person needs for their activities of daily living. So toileting, movement, walking around, help with medications. That's not one of the ADLs, but anyway, so they'll do this whole assessment. They'll come up with a determination about how much care, what kind of care you need, and then they set the amount that that you're eligible for Medicaid to pay, again, to pay the facility. What else, Ashley? Am I missing anything?
Yeah. So we have a question in the chat, which is a good one, is if a caregiver under COPES at home is considered long-term care. It is. It's a type of thing that you can be eligible for in your home. And then, but some folks, either if they don't have a home or just their needs, whatever, they instead then kind of take that eligibility for COPES, for long-term care, for personal care, and it's kind of transferred then to a facility like an adult family home. So that's kind of what Meredith is saying, is like needing these extra supports, or sometimes it's that people have behavioral health needs, and so then maybe in that situation they'd be in an assisted living facility with Medicaid paying for part of that, or kind of other resources. And then if you have kind of on top of those needs with toileting, dressing, that sort of thing, like Meredith was saying, that might be more of like an assisted living facility, adult family home. Let's say you actually have some nursing needs in addition, that then might be more of like a skilled nursing facility, that sort of thing. The main thing to know though is there's kind of like those two parts of eligibility for Medicaid long-term care. One is that financial part, and then the other is needing that extra support, medical support, kind of personal care support, all those sorts of things. So these are pretty these are folks who need these extra supports to be able to live in facilities, like these. And do you mind going to the next slide, Meredith?
Yeah, and I'm just to follow up on what you said about COPES. I was just thinking we're really focused on long-term care facilities, but long-term care Medicaid includes COPES, like caregiver services in the home. So yeah, that's great. This is you, Ashley.
Perfect. So what is an illegal discharge and why does it matter? So before we get into kind of the weeds of everything, and discussing the law and advocacy strategies, we want to talk for a minute about why Northwest Justice Project advocates are taking these cases and why illegal long-term care discharges matter. So people who live in long-term care facilities, which Meredith just described, are eligible to live in these facilities because they generally need extra support beyond just the housing provided by a typical apartment rental. So those can be skilled nursing facilities, or they need that support with activities like dressing, bathing, toileting, etc., or mental health supports. So these facilities, as Meredith said, allow very vulnerable residents with medical and support needs to remain living in the community. But in the cases we see, which we'll describe next in some case examples, the situation generally is that the facility, for any number of reasons, although often, quite frankly, because the resident has some sort of a challenging personality. You know, because our people are your people. The facility decides that they don't want the resident to live there any longer for any variety of reasons. And they'll essentially evict the resident or lock them out for impermissible reasons without any of the legal protections that the resident is supposed to have to fight to fight the discharge and fight that lockout, because kind of the structure under the law that Meredith and I will talk about a little bit more is in recognition that these are folks who are in these facilities because they really need this extra support. The legislature and state agencies, they've put into place actually a really robust set of protections for folks in these facilities, not only while they're living there, but saying also, if you no longer want someone to live in your facility, you have to do a whole bunch of things to make sure basically that they're not just left in the hospital or dumped on the streets or in a shelter. Like, you have to figure out a safe way to do this. And in the cases that we see, which are unfortunately way too many, facilities don't follow those rules and folks do get kicked out and are really, really harmed by it. So because of MLP's relationship with Harborview, I often see situations where that resident is either taken to the emergency room and the facility tells them they're essentially evicted, that like now it's done because they're physically out and they're in their emergency, or where the resident is in the hospital for a more extended stay because of maybe like a medical procedure or something like that. And then when they're medically ready to discharge from the hospital, meaning they don't have more medical needs and they're ready to come home, the facility just says, oh, sorry, you can't come back. We already filled your bed, or whatever like that. However, even in this situation, it can often end in homelessness. A recent example from MLP and that two of my colleagues handled is where a facility told a Harborview patient that they could not come home. The patient was medically ready to leave Harborview and wanted to go home. So when Harborview discharged them and kind of took them back to the facility, the patient wanted to go home, and the facility physically locked them out and had a notice saying, no, sorry, you're just done. So then they ended up from there at the Salvation Army shelter, and they're in a wheelchair and it's really not appropriate and safe for them. And the facility has basically just said, sorry, we're done. So in that case, MLP intervened and we filed an administrative appeal, which we'll describe in a little bit. And the resident was readmitted to the facility after an administrative law judge ordered the facility to let them back in. These illegal discharges often result in unnecessary hospitalization, which is not good for resident health. It can end up in situations of the resident being in shelters, being on the street. And there's also the issue of transfer trauma. And Meredith, I don't know if you want to say any more of that. You see that certainly a lot with the elders that you work with. So transfer trauma, which primarily affects older adults moving from kind of one setting to another, is actually a type of trauma from moves, especially when folks may have dementia or other cognitive things going on. And it can cause folks really significant stress that can lead to significant health complications and even premature death. We also know that there are significant racial and disability justice implications for these cases. People of color are often targeted for involuntary discharge, very similarly to how they're often targeted for eviction. And people with disabilities, especially mental health disabilities, are disproportionately targeted for involuntary discharge, and may additionally then have a really difficult time even understanding what's going on and not knowing that they have legal rights and that this shouldn't be happening to them and that there might be things that they can do to get back in. So that is all why we think that these cases are really important. Is because these residents do have rights, and really preserving that supportive housing that they have, allowing them to be safe and healthy and living in the community is so important. So let's go to the next slide, and we're going to start off with a couple of case examples that we see first in the hospital, and then Meredith will talk a little bit more about the cases that she tends to see in the non-hospital context. Okay. So client story number one, which is discharge at hospital. So a resident of, and I apologize, that's a typo. He was actually in an assisted living facility, not an adult family home. This is a case that came to MLP. He had a pretty complex social history, and he was in some supportive housing and assisted living facility for people with behavioral health needs. And he was on a walk, and he was physically assaulted from behind, and his eyes were gouged, and he was left blind. The ambulance came, took him to Harborview. They immediately tried to perform surgery to restore his sight, and they unfortunately were not able to. And so then he was in the hospital recovering from his surgery. He actually was medically ready to discharge within a couple weeks of being in the hospital, and wanted to go home, especially, as you can imagine, because now with his medical condition of blindness, he wanted someplace familiar to him. He wanted to be back where he knew the building, knew people, things like that. And the facility really took this as an opportunity to say, oh, sorry, we're not letting you come back. So MLP, we were referred this case from Harborview, and we worked really close with the medical providers there. We filed a reasonable accommodation request, which we'll explain in a little bit, and then an administrative hearing request. An administrative law judge said to the facility, yes, you need to let him come back because you did not follow the procedures, and kind of your reasons for wanting to kick him out are not the legally permissible ones. The facility actually refused to let him come back, and it was appealed up to the highest kind of administrative level in the state. They again said, you need to let him back in. The facility still refused. And this is unusual, I will tell you. Almost all of these are resolved at a very, very low level. This one just happened to be a little more complex. And so then eventually Northwest Justice Project and the Medical Legal Partnership, we ended up filing a lawsuit against the facility in King County Superior Court for under basically unlawful discrimination against him. And we won on what's called a preliminary injunction, where a King County Superior Court judge did order him to be readmitted. And so he was readmitted and went home. And now he is in a place that is safe for him. And so that was that one. This next one, which again is in that hospital.
Ashley, something occurred to me too.
Yeah.
He's relatively young. I think about sometimes, and maybe it's because they work with senior, but we say assisted living, we say nursing home. In my mind, I go to an elderly person, but there are quite a few rather young people living in assisted living and adult family homes and nursing homes.
Yep. That's absolutely true, Meredith. And that's a really, really good point. Yeah, he was quite young, and he originally had been in the assisted living facility because of his behavioral health needs and kind of the support that that assisted living facility could provide. But beyond behavioral health, there's also, physical health. If someone has some physical health needs, and it isn't like they have a home that they can be living in, and they need like nursing support or support just because of their medical conditions, with those things that we're talking about, like toileting or dressing or whatever like that, it's completely possible, and often happens, that they'll be in like an adult family home or assisted living facility or skilled nursing facility. That's a really good point. Yeah, so it is really across the age spectrum. This next story, kind of from the hospital, is where the facility had dropped the resident off at the Harborview ER. She did not want to go to the ER. She did not believe that she had anything that needed for her to go to the ER, and the facility kept saying, no, we're just going to call this ambulance for you and take you away. And really it was a pretense that she was potentially like her heart, like some beating irregularities, things like that. But they had also been trying to get her out for a while. So she was taken to the ER. And then while she was there, they said, no, you can't come back. We wrote them a letter kind of outlining why they're not allowed to do this. She was admitted to Harborview kind of while this was waiting to be resolved, but we were able to negotiate it out with the facility in pretty short order, and she was able to go and she was able to go home. And that's really more typical. And Meredith, maybe you can talk a little bit to like either negotiation or it gets resolved at kind of a much lower level and pretty quickly, instead of that first case that I was talking about where it really kind of dragged out for months and months with all those various levels of appeal. But this is pretty typical of what we end up seeing at the Medical Legal Partnership.
Yeah, and as I mentioned, while many of Ashley or all of Ashley's clients are in the hospital, so she's seeing more of these cases where the resident's taken to the ER sometimes, you know, oh, we're just very concerned about you, and then left there. I'm usually seeing the folks who are still at the assisted living facility or nursing home, and they've gotten a notice from the facility saying, you know, you have 30 days to leave. So client story number 3, again, relatively, I believe he was in his mid-50s, but he had MS and so needed more and more care. And it had progressed pretty quickly because his housing was unstable. And so for many years, he wasn't getting the kind of help he needed. He was, when he entered the facility, in pretty bad shape and was using a wheelchair, had a lot of arm weakness, so wasn't able to transfer himself from wheelchair to other surfaces. And so, but fortunately was, started living the assisted living, started getting care, started getting PT. But he and another resident were a little unhappy with the way that the assisted living facility was running, and the variety of reasons. The food wasn't adequate, and there weren't activities and those types of things. There were some safety concerns, so they filed complaints with residential care services. So if someone living in a facility has a complaint about the facility, they can file it with the state. And so they had filed, and then the state reaches out to the facility and does an inspection, all this stuff. Anyway.
And Meredith, actually,
yes,
this is related. We just got a great question, which is, what if the facility doesn't treat the client with the care and respect they need, which is that RCS process, or maybe also talk a little bit about the Ombuds office too?
Oh yeah, yes, good. Yeah, good segue. Yeah, so so residential care services with DSHS, they're the agency that licenses the facility. So they have a lot of power to, you know, pull licenses or find the facilities. We found it can be a little hard to get them to take action. I'm generalizing. They will come and do inspections. I think sometimes even just them showing up is helpful to get the facility to maybe fix some problems. And they do make findings where there have been safety issues. However, for residents, there's also the long-term care ombuds program. It's a statewide program, and then they have local offices, and these folks are there to represent the resident in negotiating issues with the facility, and are super effective. And they also will sometimes represent residents in these administrative hearings that Ashley mentioned, and help. Anyway, they're a great resource. So if somebody is living in the facility and is having a problem with the facility, we always recommend they reach out to their local long-term care ombuds. A lot of times those folks can come in and ask questions and get files and advocate on behalf of the resident. And sometimes that takes care of the problem. In this case, the residents did both. They filed the complaints with, actually, I'm sorry, let me back up. They contacted the long-term care ombuds, who was very active and very invested in trying to help them. It was the long-term care ombuds who helped them file the complaint with the state licensing the residential care services. So they do a variety of things, and we usually recommend that residents reach out to them. And they've been good partners to us as well. After the complaints came through and residential care services reached out to the facility sent notices, I want to say within like 2 months, to the residents who filed complaints saying they were being discharged for because their medical needs had increased. And they were going to send, I know at least these 2 residents who had filed complaints, and maybe some others who had they formed a little coalition of residents who were filing complaints. But the 2 ringleaders, my clients, actually I had both of them as clients, received notices shortly after filing complaints, which is clearly retaliation for filing the complaints, because as it turned out, their medical needs hadn't increased. So for this client, he actually had improved. He now had, stable housing and assisted living facility, was getting PT, and had built up his arm strength and was able to help more with transfers. So, they are allowed, we'll go over the allowable reasons for discharge. One of the allowable reasons is to discharge if your medical needs have changed. Maybe you don't need the level of care that they provide and could go to a different kind of facility, or you need more care and they need to send you someplace else. So in this case, we did file an appeal of the discharge notice that this client received. There were a variety of problems with the discharge notice. It was missing information. But in addition, we, challenged the reason for discharge and submitted a lot of information from his medical providers to show that really his medical situation his level of care hadn't increased. In fact, it had improved. We ended up not going to a hearing in this case because we were able to negotiate with the facility, and they said, oh, okay, we'll let him stay. So like Ashley said, it can kind of run the gamut as far as how much, but a lot of times in these cases, we can work with the facility, or honestly, for us, the facility's attorney to resolve the issue. I would say probably the most common reason I see discharges where folks have gotten discharge notice is for non-payment. So, and what happens, I described earlier how there are folks, when they go to the facility, they might have some money in savings, so they don't currently qualify for Medicaid. So they go to the facility, they're private paying, and then that savings works its way down. They don't have the money to pay anymore, so they're short every month. And they might not know that they should apply for Medicaid. There are some facilities that have social workers there, which, who help them apply for Medicaid, which I feel like is, wonderful, but it's also within the facility's self-interest to have a social worker helping folks apply for Medicaid. So they don't have folks living there. I had one where she lived there for 2 years, not paying her total amount because she just didn't know, and her family had sort of disappeared, but didn't apply for Medicaid to help pay for the cost of care. So she was short every month. Eventually they gave her a notice of discharge saying you haven't paid. So that's, I would say most of the time, that's what I'm seeing in terms of discharge, that it's a non-payment issue. And so again, this is the client story number 4. The notice had a couple of problems. So, gentleman living in an assisted living facility, he had run out of his savings, wasn't able to pay the full amount, didn't have Medicaid, didn't apply. The facility didn't talk to him about that either. And so every month he was short. He got a notice of discharge, and again, it had a few problems. We'll talk about kind of the typical problems we see with notices, but one of the major problems was the facility has to write the location to which the resident will be discharged. And it can't just be anywhere. It has to be an available and accepting location, and it has to be appropriate. So in his notice of discharge, it said he would be discharged to a shelter. This was a client who was currently receiving chemotherapy in a wheelchair, a variety of other disabilities, certainly was in assisted living for a reason. As Ashley said, these are usually people who are very vulnerable. So discharging, you can't just put them out on the street or discharge them to a shelter. They need to go to a facility that's appropriate. The facility that he was living in should have called the potential new facility to say, are you available? Do you have beds? And can you provide the level of care that this person needs? And so this one actually did go to a hearing, and the judge determined that the location listed on the notice was not appropriate. We've had some others where the facility will just kind of write the name of a local assisted living facility and say, oh, we're going to send them there. And when we call the potential new facility, they're like, we don't know anything about this resident. So that's not okay either. And judges have ruled that that's not appropriate either.
And Meredith, building on that, I think, we suspect probably that in a lot of these situations where they list this inappropriate discharge location and they haven't really done the planning, maybe they have someone's like friend or family member like come pick them up because the resident doesn't know that that this shouldn't be done. The friend or family member then is like, wow, you actually have some high level of needs. This isn't safe. I can't do this. And then from there, the person might end up unhoused. I know also, this wasn't your case or my case, but another NJP attorney had a case where I think it's somewhat common, like where someone needed dialysis and a shelter was listed, and then clearly that's not appropriate as well. And so just all sorts of things, either like a shelter isn't going to be able to care for the person, or there might be sort of a phantom place listed, but really it's probably like, oh, here's a bus ticket, or a friend or family member comes and picks the person up, but then quickly realizes that they can't attend to the needs. And then the person's in a really unsafe situation after that.
Yeah, it's good that you mentioned that. I had a client, the daughter of two people living in an assisted living facility. Sorry, this was a couple of years ago. She got the 30-day notice of discharge. It was not appropriate for a variety of reasons, but the discharge location was to her apartment. And she didn't know any better. So she went and got her mom and dad from the assisted living, super high needs people. The dad had pretty advanced dementia, and like took them home with her because she just thought that's what she was supposed to do. Obviously she wasn't capable of providing the care they needed, but she didn't know what else to do. So like informing folks of their rights, getting them in touch with the long-term care ombuds before this happens is really important, so people understand that they do have a lot of rights.
So how will this look for all of you? So Meredith and I are not intending to turn you into legal advocates, but really the purpose of this presentation is allow you to issue spot, and maybe some of this is ringing a bell for you in terms of folks that you're encountering in your work, and you're like, do you know what? I think actually, number one, oh, this person, has medical needs, behavioral health needs, is a low-income person. They said that they were living like in a place that was supporting those sorts of needs. That sounds like probably, from what Meredith and Ashley are talking about, that probably they were in a long-term care facility. And then, you know, why are they here with me right now? Were they told to leave, or were they kicked out, locked out? Were they driven to a shelter and dropped off? Were they taken to the hospital, to the emergency room, and then not allowed to come home? All of those are kind of indicators that you might be dealing with an illegal discharge that Meredith and I are talking about, especially because, and Meredith's going to talk about this in just a minute, but there's actually a requirement of these facilities, and Meredith has had an administrative law judge rule on this. A couple of my colleagues on medical legal partnership have had a judge rule on this, saying this whole thing about the discharge planning and the discharge location is really, really important, because the basic thing about that is that if a facility wants to discharge someone and is saying, this is not the appropriate place for you to be anymore, they actually have to plan, as Meredith said, an appropriate, accepting, available facility for the person to go to. Like, the person should generally not end up in the hospital with nowhere to go, or in a shelter or another, you know, inappropriate place, unless they themselves voluntarily were the ones who said, I want to leave and I don't want to be here anymore. Because if the facility is the one that's initiating this discharge, on top of kind of all these procedural protections and things like that, they actually need to find that location. So the person should be going from one appropriate location to another appropriate location. And so if you have kind of an inkling that someone was in a long-term care facility, that they wish that they were in the long-term care facility rather than in their current situation, it's likely that all of this is involved. And then they have appeal rights. They have a certain amount of time. Usually it's about 90 days from the discharge to file an appeal with the State Office of Administrative Hearings that Meredith and I are going to talk about in a minute, to have an administrative law judge actually say, do you know what, facility? You have to let the person back in. You have to let them back into their room and their bed that they were in. But even that 90-day deadline, especially if the facility did not follow certain rules about notices, about like letting the person know in writing that they even had this right to a hearing, you know, the person might not know, like they might have actually much longer to file these appeals and things like that. So this is just kind of about like issue spotting and awareness and saying, oh wow, like actually I think that this may have happened to people who, my clients, you know, people I know, that sort of thing. And then knowing where there might be resources or next steps, so that then the person might be able to either go home, or, you know, some sort of interaction then with the facility, where the facility actually does some safe discharge planning to make sure that the person can go to an appropriate and safe next location.
Hey, Ashley, it looks like we've got some questions in the chat. Do you want to take a break to answer?
That sounds good.
Okay. Jody, are you tracking that? Do you want to ask the questions?
Yeah, so we're going to go back a little bit,
Yeah.
But just generally, and I suspect this will kind of come at the end, but just to highlight, you know, just what are the best ways to contact MLP or Northwest Justice Project, you know, and exactly the types of situations that should be referred. So just kind of have that going on. The other quick one might be who does these assessments for like identifying the needs and where to appropriately place someone. So we'll start with those two, and then we've got a couple others.
That sounds great. So I can talk about MLP and reaching out to us and things like that. Both Meredith and I have our email addresses at the end of the slides today, and I think Meredith too. Any of you can certainly reach out to us with kind of follow-up questions and things like that. We prefer for it to come through you rather than clients kind of directly. Meredith has a story about her number and name being given out like candy at some point, but happy to hear from any of you. I'll tell you though, with the medical legal partnership, kind of our model is that it's social workers and medical providers at Seattle Children's and Harborview who refer cases directly to us for a number of reasons. And so it may be then that if you reach out to me, or, you know, you may then want to be in contact with the providers there, so that really raising their awareness of this and have them reach out to us. But we're pretty flexible, but we get our referrals kind of directly from providers in general. And then Meredith, reaching out to you and kind of how you.
Yeah. I mean, I think you said it correctly. If y'all are providers, please feel free to reach out directly. Just email is usually the best way to get a hold of me. And you know, if you just have a quick question, like, I'm not sure about what's going on with this client. I would say too, even if it's sort of not related to what we're talking about today, if you're just like, oh, this person's having this issue, feel free to email. I would say if you are trying to give our information to a client, we'll tell you how to refer clients directly to us. You can, I would say my referral system is a little less formal. So I get referrals of clients through our Clear line. I also, again, I have providers like the long-term care ombuds or social workers working in the community, Jewish Family Services, ADS. They'll sometimes write about a client and say, you know, I'm working with this person, here's the issue. If it's something I can help with, I might be able to take that referral, or I always say I usually can find somebody or the right place for them to go. So again, if you're a provider, please feel free to reach out to me directly or Ashley, and then we'll touch a little bit more on what to tell clients. If you're just saying, hey, you should call the Northwest Justice Project, we'll figure it out. But yeah, Ashley's right. I did do a presentation one time to social workers, and I was like, happy to answer your questions. Here's my email. And then I started getting all these calls from nursing home residents, and it turns out that the person was just like handing my information out to all the residents at nursing homes. So please use wisely. But I'm super happy to answer. I love connecting with the community, and we're all doing the same work, so we should be working together. And then wait, what was the other question?
It was about assessments and who does the assessments. And I think you actually have far more knowledge than I do, but I know it's basically kind of as a starting place is kicking off a long-term care application with DSHS. And I often see it through Home and Community Services, I think. And they then kind of, once that application is made to DSHS, then they start doing that financial and functional eligibility and things like that. But
yeah, and I think for clients, you'll see they'll call it their worker or their case manager. It might come through the Department of Social and Health Services, like their email address will have that. Or I think they contract, I don't know how it works exactly, but they sometimes contract with other agencies or nonprofits. So like a lot of my clients, the person who comes to do the assessment of their needs is from Lifelong. So you might hear a client say, oh, well, you know, so-and-so from Lifelong did my assessment, just to let you know that. But yeah, it's whoever is contracted with the state to do an official assessment. Yeah. To make some jaws drop. Uh-oh. Make sure you mute your there we go. Okay, Jody, any other questions? I think there were a few more.
Well, I think one of them was just sort of, are there resources, agencies that help assist folks through the navigation of these assessments? And it sounds like folks might get a caseworker. There are public benefits attorneys that specialize in different public benefits that can sort of help with sort of that eligibility, application, approval, denial type of process. I don't know if you have anything specific. And then does Medicare, like if someone, you know, has too many resources for the Medicaid eligibility, is there any Medicare coverage? Those were a couple more. And then there's a couple big ones that are kind of very similar that I'll throw at you here.
Medicare doesn't cover long-term care. I mean, there's like, I think it's like 100 days at the hospital they'll cover. There's very, very short period of time to Medicare, but I think people are often shocked to find out that Medicare is not covering this. That's why it's a problem. And I don't want to get too far into it, but it's a problem. That's why the Medicaid system is the largest payer of long-term care services in our country, because insurance isn't great. Medicare is not covering it.
Thank you for that. So the other, the big one, there's a couple questions that I think are around the same subject, but sort of, where are folks staying while their cases are being worked out? And when folks are seeing someone who has these needs and maybe they don't know if they actually have been inappropriate or illegally discharged, but how do we, is there a referral process to help get folks into these services? And, how long does that process take? I think those are a lot of the questions that were coming up, or if, really vulnerable client at a particular shelter, has a power of attorney, needs higher term, long-term care. So some of those types of resources where they may not know exactly like, oh, this situation definitely happened of an illegal discharge. You're both nodding.
Mm-hmm.
You're getting my drift.
Yeah. And if we forget something or miss something, feel free to re-ask, Jody. But I will just quickly say most of my clients, the client is still living in the long-term care facility. I think that's correct. Yeah. And so the law says if they ask for an administrative appeal, they can stay in the facility during the appeal, but probably Ashley has a better answer that would be more applicable to your work.
Yeah, potentially. I mean, because we see folks either who are in the hospital or really have already, for various reasons, they're like totally just out. They're couch surfing, they're in shelters, they're, whatever, and kind of how we get that referral. And so when we take these cases, and I would say, certainly you can reach out to us, to Meredith and I, if you're and you kind of don't even really know, and we can kind of do some digging and figure out if this is going on. It's true that folks kind of stay generally in the unsafe situation that they're in, or in the hospital being unnecessarily hospitalized or whatever like that, while it's being resolved. We often will try to move these cases along quite quickly, and we will typically try to and sometimes we're also able to work with the ombuds office that Meredith talked about too, and kind of coordinate, but like you want to get in touch with the facility. So knowing like who the facility is, getting a release from the client so you can kind of discuss, and even just get an outline of like, what is the situation? And then if it seems like there's merit there, filing this appeal with the State Office of Administrative Hearings and getting that done. And then we often, and it's funny, it's, I think that folks who are, because I work so closely with so many medical providers and service providers who are used to things moving really, really quickly, which makes sense. They're surprised and frustrated at how slowly the legal process works. We can often get what's called a summary judgment hearing in that State Office of Administrative Hearings within like a week or two of filing the case. To us, in legal terms, that is like lightning speed. We understand that, there's a lot going on for the client while that's happening. That's actually like pretty quick in our world. So just kind of some general kind of context around that and that sort of thing. And, sometimes it's possible, often not, but sometimes even like us doing that original outreach to the facility and saying, hey, you're on our radar. We're getting this report that this, and this was not good, requesting some records from the facility and saying, can we work something out? Like, we're filing this administrative hearing and seeing, can our client get back in sooner rather than later, is how it works.
And sort of adjacent to that, oh, go ahead, Meredith.
No, I was just going to say, just to summarize, where are people staying? They can stay in the facility. they're at the hospital generally is not going to release them to an unsafe, should not release them to an unsafe location. So they might be unnecessarily hospitalized. And then of course, worst case scenario is they're in a shelter or in an unsafe housing.
And I don't believe we actually talked much about this in sort of prepping for this presentation. So maybe it's something that we follow up with after the fact, if there's resources that you all have. But there's another comment in the chat about, someone who maybe was prematurely discharged from the hospital setting back to like a permanent supportive housing facility. And I think we see this a lot where folks that are like probably most definitely would qualify for long-term care, but the placement can't happen. So that initial placement, do you have resources, thoughts? Are there legal actions for people that actually qualify but are being denied at the onset, or how people can like start to navigate that situation?
In terms of they need long-term care supports, but that's not happening. I mean,
Yeah.
Meredith, you can talk a little bit more. It would be a matter of kind of getting that process started with DSHS, and then if they are denied, certainly there's a right to administrative appeal on that. And sometimes we see, and Meredith, you have much more kind of experience with that denial of long-term care and things than I do, but I know kind of with regular Medicaid and with Social Security and other kind of asset-based programs, the agencies will often think that there are resources that are financial resources that are available to clients that are not actually available. And that can kind of be an issue then in terms of working that out with DSHS or whatever like that to make sure that folks get what they need. Other thoughts on that, Meredith?
Yeah, no, I think that's correct. The initial, and I guess I would just go back really quickly to the question about having a crappy power of attorney, like, for lack of a better way to put it. But there are a lot of people who think, oh, my son is definitely going to be a great agent, and my power of attorney is going to take care of everything for me, or this friend or whoever. And then that person disappears and now they don't have a power of attorney. So I would say, on the one hand, if they still have the capacity to make decisions for themselves, finding an agency or social services that will help with the initial application is great. They can, as long as they can sign the application and work with the social worker or case manager who can help them apply for long-term care Medicaid, that's great. They could also appoint a new power of attorney if they have somebody. It gets certainly more complicated if this is somebody with very little capacity or no capacity to sign documents or understand what they're doing. And then we're sort of veering off into this idea of guardianship or protective arrangement with somebody who can help make decisions for them. But then just sort of going back, there are a variety, and y'all might know even better than we do because we aren't helping people with applications for Medicaid, but you might know services or different agencies that will help with the application. And then if there is a denial, as Ashley said, and it can be a variety of things, sometimes it's fixable, like, I don't have access to that house in Azerbaijan. Like, it's not making any money for me. That's not a resource. So, yeah. So if there is a problem with the application, somebody's been denied unnecessarily. I don't know, and again, this might be something, and I don't know if this is what the question was about, if there's somebody who's qualified, but they can't find a place to be, and I don't know if that's the question, and I guess I'm mentioning it because I don't have a great answer, to be honest.
Yeah.
I
agree with that unfortunately I don't have a great answer, and I know that that's obviously a problem of someone being eligible and just there isn't an accepting and accepting facility. And that's, you know, a little bit different than what we're talking about today, but is obviously a really legitimate problem. The other thing I'm seeing a little bit, it seems like in the chat, another kind of vein of questions is also if folks see patients who, or clients who they believe were discharged from the hospital too early back to their whatever their residential setting is. And I'll say that again is a little bit different than what we're talking about today in terms of hospital discharges, although obviously is a problem, and you know, we're always on the side of our clients. I would say that there are complaints that can be made either internally at the hospital, like a complaint process that the client can do, and then I know also the State Department of Health regulates hospitals and other facilities, and complaints can be made to them as well. I'm not really, it's just not something that we necessarily deal with as often. So I don't know how responsive those Department of Health complaints are, but that's an official channel that I know does exist.
Thanks for that. And then very nuts and bolts, clarifying a question earlier, like how long does the actual process take to the initial application for long-term care services, roughly? Assuming they don't get in a denial right off the bat.
Go ahead, Ashley. Do you know?
I think, oh my gosh, this is so, because since we don't do the applications, it's just, but I believe it's like 45 or 60 days is what I want to say, because when there's a medical determination, it's like, because I think that for most things that are purely financial with DSHS, I had to look this up in a different context the other day. I think it's usually like 30 to 45 days, but because there's that medical eligibility piece too, I want to say it's more like 60. Does that sound right to you, Meredith? And maybe they can ask for more time too.
Yeah, I think so. And certainly for folks, again, who are living in the facility, even if they're not paying for a while, they'll get some retroactive payment. So if the timing doesn't quite match up, but of course that doesn't help if you're not in the facility. You know, it certainly gets longer when there are complications with the resources or different things. But, and I would say too, I haven't had this in a while, but I did have some success with asking them to move quickly. So I did send a letter to DSHS on behalf of a client one time because they had scheduled her assessment for some like a month or two away, but she was really in need of services as soon as possible. So just sent a request, and I don't know that it was anything magical. It was just like, listen, this person has super high needs and needs care right now. And they moved up the assessment period. So
great. And then we might be getting to this. So if we are, we can kind of like hold this, but I'll throw it up now. Really good sort of scenario in the chat of someone that provider that's been working with someone who's currently in a facility, you know, complicated physical, mental health issues. How, as a case manager, do we best advocate for folks? Who do we partner with? How do we, you know, begin this process, you know, so that we can kind of anticipate coming out. So, and if we're ready to move on, we can, and I'll continue to track. So.
No, that's such a great question. It's also like so proactive, and we really appreciate it because, you know, I think Ashley and I see most of the things we're seeing, it's after things have just really gone off the rails. So I think partnering with the long-term care ombuds office, you know, if you see problems that are already starting to crop up with the facility, or you have questions or whatever, it can't hurt to reach out to them, and then they've got their eyes on it too. And then, you know, if there's anything, again, if you want to reach out to Ashley or I, like, you know, is this okay what the facility is doing? Like, feel free to do that as well. But yeah, and then I'm always like, again, such a lawyer, but like such a good fan of documenting everything that you see with regards to, I'm sure you have your own documentation. Don't need to tell you, but I think it can be really helpful, again, if you kind of foresee there might be problems in the future. I hope that answers it. Ashley, do you have anything?
No, I agree with you, Meredith. And I think reaching out to the long-term care ombuds office. And, I think it's helpful to identify if you see that things might be going south, like as soon as possible, being kind of clear about what do you think a solution might look like to resolve some of the underlying issues that are happening. Like, is it, I don't know, transportation to medical appointments, or like medication is always delayed or something? Or are there just or do you see that there's going to be a need for that Medicaid application down the road? Like, being pretty specific about some of those barriers that you think there might be that actually could work towards a resolution is going to be really, really helpful, and help you for yourself kind of like plan what issues do I need to work on to kind of de-escalate and keep this a good situation, rather than it moving on to a bad situation.
Okay.
Great.
We can move on to I love all the questions, and I actually would rather answer questions to be responsive to you all to make sure, but we can keep moving through our presentation if that works. Okay, cool. I think this is me. I'm talking about the reasons for discharge. We mentioned before that a facility can't just discharge somebody because they want to. There are specific reasons that at least they have to write down for the discharge. So again, if the residents' healthcare needs have risen, if their health has declined, and they need a different level of care than the facility can provide. So we'll see this more in like an adult family home or assisted living facility. Or it might be just that facility doesn't provide the kind of care that the person now needs. The opposite is they've improved, and maybe they don't need the nursing home level of care. They could live someplace else, or they could live safely at home with an in-home caregiver or something like that. They might discharge for that reason. If they present a health or safety risk to the community that they're living in, that's another reason they might discharge or transfer the resident. Unfortunately, we see this with the folks with the challenging behaviors, but it also was a big deal during the pandemic because, again, they were trying to really control the spread. So they were transferring, discharging people to different places, depending on the healthcare needs. And then, as I mentioned before, non-payment is a big issue that I see a lot of, where somebody hasn't been able to afford their cost of care at the facility, and then of course if the facility is closing. And then I want to talk about how the long-term care facility can discharge a resident. So there are specific requirements. They have to, sorry, hang on, there we go. My little Zoom bar was like covering part of it. I don't want to forget anything. So in order to discharge somebody, the law says for all of these facilities, they have to give the person a notice that gives them at least 30 days before the proposed discharge. It has to be in writing. It has to be in a language that they can understand. They also have to give copies of the notice to the residents, agents or family members who are known to the facility as a representative. If the person is getting Medicaid, they have to also notify DSHS that they're planning to discharge or transfer the resident. They have to list the specific reason for the discharge, and it can only be one of the reasons I mentioned before. We mentioned a few times they have to list out the location for the discharge. So they have to state where the person will be discharged. It has to be available and accepting in an appropriate location. And then they also need to notify the person they have the right to an administrative appeal to appeal the discharge. And I don't have it on here. They also have to list the contact information for the long-term care ombuds program. And then that some other challenges we've brought to discharge have to do with other requirements that the facility has to engage in. So we just talked about kind of the notice requirements, what has to be on the notice, but even before the notice, there are things the facility has to do. They're all towards trying to avoid discharge. So we talk about reasonable accommodation. This may be a little different than what you're used to thinking of. Reasonable accommodation in housing typically has to do with providing facilities services in housing that would make it accessible for a person with a disability. So we typically think of reasonable accommodation for a grab bar or a service animal. When we talk about long-term care, discharges, and reasonable accommodation, this is anything the facility can do to try to avoid the discharge. They might say, oh, we just don't have, I'm making stuff up. We just don't have a Hoyer lift, and that's something you need. Well, you can get a Hoyer lift, like that's an accommodation. There might be some changes. Maybe there's a behavioral issue, but it has to do with where the resident is located in the facility. So maybe moving the resident to a different location would help, again, avoid a discharge. So they do need to show that they've tried to accommodate and the resident and try to avoid the discharge.
And Meredith, in those non-payment cases, I know a good reasonable accommodation that you have asked for is also more time to actually allow that whole long-term care application to go through, for that Medicaid to get started, that sort of thing, and saying, hey, the problem here is really time. Can you hold on, basically, as a reasonable accommodation while we get this all sorted out?
Yeah, absolutely. Yes, that's very related to the question that was asked before, that, if they get a notice. Again, my client who lived in the facility for 2 years, no Medicaid, power of attorney was, we don't even know where, but, and she had very advanced dementia, was not able to apply for Medicaid on her own. So one of the things that we asked for was to, or one of the arguments we made was that they didn't try to accommodate her by helping her get the funding she needed, but also, give her more time. And they did. They gave more time for that process to go through. She got the Medicaid, and in the end, they ended up letting her stay. They were all up until that point going to move her, and then they decided to just frankly eat the cost that she owed and let her stay, because now she had sufficient monthly income or support to pay.
And Meredith, I would say too, this is really related back to that great question that we had about how folks can work with or advocate for their folks that they know are currently in facilities, is if you think that there is a change in the rules, policies, or procedures, or something that the facility could reasonably do to kind of fix the situation, asking for a reasonable accommodation on behalf of the patient, obviously with the patient's consent, the resident's consent, but really kind of like identifying what that solution might be that we were talking about. Like, is there a Medicaid application that's needed? And is there more time? Is there something about like tracking down a power of attorney because there's like some weird issue? Is there like a conflict with a particular resident, and a reasonable accommodation to move to a different part of the facility so they're not in touch with that person? Like all sorts of just really, really practical changes that the facility could make to smooth out the situation, even if it's kind of a short-term inconvenience to them, to avoid that discharge, can be really, really helpful.
Yeah, no, that's great. When you talked about I'm remembering with the power of attorney issue, it was, she had 4 kids, adult, I'm calling them kids, they were my age, but 3 daughters, and then youngest child was a son. She appointed the son as her power of attorney, and he's the one who just like, nah, not interested. Like it just sort of disappeared. The daughters, meanwhile, are super involved. So as it turned out, the power of attorney form listed a couple of the daughters as the second. So we were able to then get him to revoke or just to make a statement that he no longer wanted to be the power of attorney, and we were able to work with the daughters. So sometimes, again, there are solutions that, fortunately are non-legal, don't require going to court. So the other thing I want to mention too is that the facility in addition to, we've kind of mentioned this idea of discharge planning that involves calling around to different facilities. Hey, do you take folks who, have these specific medical needs, or, whatever the issue is that's requiring the discharge, they have the duty, the facility has the duty to try to find a place for them to go, to engage in, safe discharge planning. And I think there are just a lot of facilities that just don't realize that's their obligation. I've had a few, spoken to a lawyer for a facility that said, well, can't we just make this person a ward of the state? And I was like, that's not a thing. And then, like a facility, a manager being very surprised that she needed to be involved with trying to find a place for this person to go and making sure the discharge was safe and orderly. So it's really important for the residents and then for all of us to know that the facility doesn't just get to wipe their hands. They've accepted the responsibility to care for this person, and that means making sure that the next location is that any kind of transfer to a different location is safe and appropriate and orderly. Yeah.
And I'll say, even though obviously we're talking today about our experiences largely with facilities who like are not behaving well, like definitely we both had experiences too, where when we kind of get in touch and the facility says, oh my gosh, I had no idea, or the attorney or whatever. And then really, like, I mean, and facilities are great. Like, so many are so great for their residents too, and really are like, oh, okay, let's do this right, or let's do the reasonable accommodation or whatever. And it really is just that lack of knowledge and kind of like the resources at RCS, that residential care services, the state agency may not be kind of giving them all the information that they need to know like how these processes work and stuff like that. So definitely not vilifying. They're great facilities. They're great facilities. Yes. We just happen to interact more often, as you do in the law, with folks who are not like the best actors, but a lot are just like they don't know and then really want to do right.
That's such a good point. I would say the majority of the facilities I work with are just, their like hearts are in the right place. They're trying to do their best. They are under a lot of pressure. I mean, their profit margins are razor thin. Like and we want these places to be available, like especially the adult family homes and assisted living facilities. But I would say by and large, when I get in touch with them or their lawyer, they really are trying their best and they're in this for the right reasons. They most of the time when there's a problem, it's due to ignorance. They just didn't know.
Great. So now I'm gonna talk about the and I think this is kind of the final major block of our presentation here, Meredith, and it's just a couple slides. This is just an overview of, Meredith and I have now referred to a number of times, the administrative hearings process and kind of what that means, what this appeal means, that sort of thing. So for residents of all those sorts of facilities, those long-term care facilities that Meredith and I were talking about, and this is regardless actually of whether they get Medicaid long-term care funding or not. So if someone is private pay or kind of has some other source of funding, actually the source of funding doesn't matter. If they're a long-term care facility that fits within one of those definitions that we're talking about, if a facility is trying to involuntarily discharge them, meaning the person has not agreed to be discharged and said, okay, I'm leaving here because I don't want to anymore. If they disagree with it, they have a right to file an appeal with the Washington State Office of Administrative Hearings to contest the discharge. And the basis of contesting the discharge can be either kind of the notice requirements that Meredith was laying out, it can be really like more of a substantive requirement. Like she was talking about that one resident who they were alleging, oh, we can discharge you because your care needs have really increased. So we think, you know, maybe you need to go to a skilled nursing facility or something rather than what you're in right now. But actually, factually, his care needs had decreased. So it can either be, or it can be that lack of the discharge planning, where the facility did not find that appropriate accepting location, or really the reasonable accommodation piece as well. The facility did not reasonably accommodate the needs of the resident. And you can ask for that reasonable accommodation actually at any point. So that means even once you're filing the appeal, and Meredith and I have both done this, you also can ask for reasonable accommodation to say, hey, listen, you know, you're saying they're out now, but we actually think, you know, there's a reasonable accommodation that can be made even now to preserve this residency. Can we work together to try to do this? And if the facility is not willing to try to make that effort to reasonably accommodate, that can also be an additional kind of defense in this situation. So it says there that deadline for filing that Office of Administrative Hearings appeal is 90 calendar days from the notice of discharge or from the discharge itself. As I said, though, especially if the facility has like not given a notice or has not given a notice that says there's this right to appeal, which again, as Meredith was saying, it's not bad will on the facility's part. A lot of times, a lot of facilities, quite frankly, are a little bit surprised when we contact them because they actually didn't know about kind of this whole appeals process or whatever even. And we obviously try to generally take a really collaborative approach, but if they didn't even know, because then thinking about it, the resident actually didn't know they had a right to appeal. And so that 90-day timeline didn't start then until they kind of like are aware. So even if, you know, it happened a number of months ago, like 4, 5, 6 months ago, it's possible that they could still appeal.
And Ashley, sorry, just on that point, I just want to mention too, I in one of my cases, she appealed like a year and a half later, after her, you know, discharge notice, because it didn't include the information. It certainly didn't include the information about her right to appeal. So we argued, you know, she had no idea she had the right to appeal. So there's good cause to accept the appeal after the 90 days. I'm thinking about that too in a situation where somebody's in a shelter and they're like, yeah, but I used to live, you know, in this such and such assisted living facility. It's in, you know, I was discharged, you know, a year ago or something like that. It may still be possible to, and probably is possible to challenge that discharge, even though that 90 days has passed. And you were maybe going to say appealing before the proposed discharge lets them stay in the facility.
That's right.
Okay.
I wasn't going to say that, so thank you so much. Thank you so much.
I didn't want to step on your presentation, but yeah, it is doing great. Like, no, I was just thinking too, and again, because I deal mostly with people who are living in the facility, yes, you have 90 days, but you might have a 30-day notice. So if I get, you know, let's say April 1st, I get my notice, well, I have 90 days to appeal. But the April 1st notice says I'm going to be discharged on April 30th. So I need to file my appeal before that discharge so that I can stay in the facility during the appeal.
Right, which is a great point and is related back to that question of, well, where can people be then during this appeals process? So like if they're there and they can stay, that's the best. And that's a reason to kind of appeal right away. And then the second level of appeal, that either the facility, if they're unhappy with the outcome of that Office of Administrative Hearings, or you, if you're unhappy, the resident can appeal to kind of, that's the kind of highest level of administrative appeal. There then are kind of like further court appeals potentially after that, but that we're not going to get into today. The one thing I do want to mention about this though, and I think this is really helpful to know, is what an administrative law judge can do in this process is say, facility, you need to either allow this person to stay, like you can't do this discharge how you're saying, or permit them to return to the first open gender appropriate bed. so that means a couple of things. One is, if every single bed is taken right now, your resident may still need to wait until a bed opens up that kind of suits their needs, even if they win. The other thing is, and I know because I've had clients with this situation, understandably, they are over this facility and they don't really want to go back because, you know, they feel that they've been mistreated. They want, and Meredith and I, you know, deal with this a lot, kind of being lawyers. And I think it also relates back to the other questions that a lot of really good questions in the chat about kind of other situations of injustice or kind of like wrongs that are related to all these questions. You know, as a lawyer, really, you're kind of focused on these specific processes and the remedies, and kind of remedies meaning what you can get out of a certain legal process. And so a client who says, I do not want to go back, I kind of, you know, I want them to have to pay me. I want them to have to like get me like some, like, this process is for that specific thing of getting to go back. And there are potentially other legal processes or lawsuits or something like that for like injustices of having been treated really, really poorly. That's kind of beyond what we're talking about today. But this is really for someone who wants to be back in their place that they were.
If I can just quickly share a story, actually, I did get money for somebody.
Through this?
Yeah, well, not through the
Well, like a settlement, probably.
You're exactly right that the judge can't do it.
Yeah.
But I filed it. This was a client, they were at a different hospital, like at Northwest or something, so it wouldn't have come to you. But it was definitely a hospital dumping case where they were like, you need to go to the ER. And she was like, no, I don't. And they were like, yeah, you do. So they sent her. There was a lot of animosity, like lots of personality problems between the administrator and the resident. As you said, resident was like, I don't want to go back there. I hate it. You know, like we don't get along, whatever. So I filed the administrative appeal, and then I reached out, think about it. Yep, they had a lawyer. They had a lawyer who I worked with, and I said, well, you know, they might have to, the end of this is they're going to have to take her back. If they don't want to take her back, they could pay for her first couple of months at the new facility. And so they went for it. like the feeling was mutual, frankly.
Yeah.
Like, so yeah, so you can get creative. I think I don't want to distract from your point, which is the administrative law judge is limited. So you might have people who are like, I'm going to sue them, you know, and had she wanted to go further and really sue them for the level of care or something like that, I don't think that's something we would have taken on. We could probably find a referral, but within this process, we were able to, I think I was just so mad that they dumped her in the hospital and treated her so poorly that it just felt like some justice, at least, to have them help pay for the care for a couple of months.
That's great. That's great. Do you mind going to the next slide? Oh, and then Meredith, do you want to talk about this one? Because I know this is one this is for.
Yeah, no, just briefly. And I will say too, we've gotten, and maybe, I guess me more than MLP, but we've gotten referrals from the Housing Justice Project. So you might be familiar with Housing Justice. They work there in the courthouse. If somebody comes in for an eviction or is having an eviction problem or a landlord-tenant problem, they can help with advice. They might represent them in the eviction hearing. So we've had a few cases come through. The Housing Justice Project referred them to me because these were people living in assisted living facilities, had gotten a 30-day notice that looked very much like a regular landlord-tenant notice. And as Ashley mentioned, that's not the, you know, these facilities are treated differently than your regular landlord-tenant. And in fact, the Residential Landlord-Tenant Act doesn't apply to long-term care facilities like all the ones we've mentioned. So those rules don't apply. There are a different set of rules that we've talked about today that are apply to long-term care facilities. So the facility could eventually end up in an eviction case, but really they have to go through that whole administrative process that we've talked about. So they can't, just example, one of the cases I got, really the very first notice they gave her was this 30-day eviction notice. look like your regularly on the lieutenant notice. When she didn't move out, they then went straight to court and filed an unlawful detainer act. And that's when Housing Justice Project said, I don't think this is right. The Housing Justice Project actually defended her in the unlawful detainer action, and the judge or commissioner agreed that the facility couldn't use that process to evict her. So then I, in the meantime, filed the administrative appeal with the administrative law judge, and we went through that process. I haven't seen it happen where they've gone through the administrative process and then, and won all the way through, and then filed the unlawful detainer action when the resident wouldn't leave. I just haven't seen that happen, but in theory, that's how it would go, I think. Then I think we're kind of through the legal stuff. I don't know if there was anything you wanted to mention, but I was going to start to talk just a little bit about resources that are available. So we do, Washington Law Help is a website that you may be familiar with. The Northwest Justice Project administers it. It contains all sorts of great information about and resources for all different kinds of legal issues. We do have, if you have somebody who just has questions about a long-term care facility that wants to discharge them, they can check out this publication. It's helpful. I feel like that's right. I just talked to a client who didn't realize she had some rights and saw our publication and asked for an appeal. So it can be helpful just to get them started to have the information they need. Oh, look at that. We're to the questions part. So yeah, so that's kind of the content of our presentation. We're happy to answer questions. We mentioned, here's our contact information if you need to reach out to us. You providers reach out to us using this contact information. And then if you're going to refer a client to the Northwest Justice Project, either the Medical Legal Partnership. I don't think I have a slide separate on that one, Ashley, but we can share that information with the group. I'll send it through Jody and Tim.
Sure, that sounds great. Yeah, thank you everyone so much. And also really, really good questions. And we appreciate you attending today. So I think we have 9 minutes left of this. Meredith, we didn't think we were going to be able to fill 2 hours, and look at it. We talked and talked and talked.
And we learned and we learned and we learned. Thank you. I'm not seeing any questions coming into the chat now, but if you are mid-type, mid-formulating, deciding whether you're going to type or raise your hand, I'm going to take a few minutes, but please jump in here to do this. So I did just put in a couple minutes ago a post-training survey. I'm going to put it in again. We really, really do love to hear how these trainings worked for you all. If you want to talk more about some of the specifics that you are seeing with your folks, there's a section to sort of self-select in, and Tim and I would love to follow up with you. I think what I will say, 2 things. I did not say this at the beginning. Anytime we have media on this call, we really ask that you really just, follow up with coalition staff and our presenters, and not, take quotes from our participants, but just really our official folks. And if you need to get in touch with somebody at a facility who had a really great question or a situation, we can help find the right folks for that. So apologize, I didn't say that at the top of the training. The second thing I will say is I really am hearing that there is this very specific scenario of folks that are at your facilities now, whichever they may be, coming maybe from hospital or just this is where they are in their life, and really probably need this higher level of care, maybe have never been qualified or accessed it before. And I think we need to, Tim and I will take this back to the team, and we might dig into Meredith and Ashley's good brains to think about how else we might think about that, or other resources to look into what's available to those folks. I had a question for you, Ashley, specifically with the medical, since you work really largely with the Medical Legal Partnership. What is your sense or your best thinking around, the number of folks that are coming maybe from these facilities, getting the hospital dumping, that aren't getting referred to you all, right? And are just ending up in, the homeless services, where our folks here today might, again, you gave some really good ways of thinking about how to identify an issue spot, but maybe a little bit more on that, because I have to think that anyone that's in a caring, human services kind of thing is overworked and overburdened, and there's a lot of cases that probably don't make it back to you. So just thoughts on that, if you will.
Yeah, absolutely. I mean, I'll say at the Medical Legal Partnership, we weren't necessarily hugely aware of this issue, like I would say 3 years ago, and Meredith can say too, this is one of the reasons why we love getting to know people in community and like really seeing who's out there and what's out there and that sort of thing, is that we don't even necessarily always know what's going on until we hear it from the community, and we hear it from clients, and then kind of my perspective, we start hearing it from our hospital and medical providers. So we didn't really know about this being an issue, and then we kind of looked into well, what could be done, and kind of like what are some of the rights that residents have here, and then starting to file these administrative hearings and kind of getting more up to speed. As Meredith said, she's gotten calls from like Northwest, from other hospitals. Like, we're kind of specific to Harborview, so I think it happens a fair amount within different medical settings and hospitals, and is more prevalent than one might think. I think now, because a lot of folks at Harborview specifically kind of know from, the work that we've done with them in recent years, they're more up on it. But I think it's highly possible that outside Harborview, not many hospitals know that this is a problem or that their clients are facing. Because like really kind of how it presented when we first started getting these cases was someone was in this place, now they won't take them back. And, we now, it's going to just be a really, really long time, until we can figure out the next setting for this resident. And I'll say, like, the resident who was, the patient who was blind, and that case took a long time. Like, he got COVID in the hospital, a lot of his friends from the facility, they had like moved around to other places. So like, he was just really separated from his home and community and things like that. And so, it's just really harmful for folks to be stuck when they're not. So I think more prevalent than one would think, and something that we've become more aware of over time.
Thank you for that. And so I'm going to gut check and say this back to you, and you tell me if I'm incorrect. But so it sounds like when we're seeing these folks today on today's training in the chat saying, like, we see inappropriate discharges often, we see folks that really need higher levels of care. This is a good place to start in terms of, have you been somewhere else, and is there some legal action that could be taken to put you in a more appropriate place? Yeah. Okay. We'll say it again, folks. What you're seeing is likely higher needs. Back that up. It is quite possible that when you are seeing folks that have those higher needs, there very well may have been resources in place at some point, and there may be legal recourse and rights that those folks have. So please reach out to Meredith and Ashley to see if that is something that is worth exploring. And then, as I said again, I am hearing that we need to, here at the coalition, see if we can't dig a little deeper to find what I know is very true, and I have heard for a long time, even when I was at public health, that there is not a lot of places for people that need that higher care. Once that they can't even initially find that right place, even if they've been approved and all of that. So you are getting tons of thank yous and great presentation in the chat. I can only say thank you and wonderful, wonderful information, and just validate that. It was lovely having you both here. We still have a couple minutes, so I'm just going to plug my post-training survey again for folks. And yeah, any final thoughts from anybody?
No, we just really appreciate you. And I'll say too, I mean, what we're talking about, and I'm seeing this a lot in the chat too, is all of these broken systems, right? So we're kind of talking today about one small loop of that system, but it is really about, with individuals like passive trauma and inadequate medical care and all sorts of things that bring them to different situations and the failures of these systems. And really, I love this thought about let's dig into some other aspects of this and like talk about this continuum and getting folks where they need to go, where it's appropriate, where it's safe, everything like that, just generally. Because obviously we all see too much folks in inappropriate places, and it's so costly, it's so traumatic, it's so unhealthy, and really, really appreciate everyone for being in dialogue with us today.
Thank you both for being here. Thank you everybody who came, for your questions, for your participation. Those of you that have or are planning to fill out the survey. More to come. And Meredith and Ashley, thank you so much. Really appreciate your time and resources today. So have a great day, everybody.
Thank you. Bye.